Hi, I'm Pete Eccleston, the Chief Marketing Officer for SBR Health. We're developing software infrastructure layer on top of televideo technologies to allow these existing and new technologies to be utilized more effectively in the delivery of new care models. Initially, we're focusing on the area of preventing readmissions through better post-discharge follow-up, care coordination, and facilitation of care transitions from acute to ambulatory care. The other areas that we're focusing on are improving access, such as ER to ICU triage, remote video triage, virtual clinics, and some forms of concierge care. So what we found is that we looked at the things that were prohibiting the scale up in the more widespread adoption of televideo in the delivery of care. And what we found is that in addition to the cost and complexities, the number one reason that was holding back the adoption of these technologies were that the existing technologies did not integrate well with the existing clinician and IT workflows. So our main goal is to produce applications that are sort of push-button simple and are very the word I'm looking for is very closely developed to specific care delivery in clinical healthcare paradigms so that they integrate well with the clinician's typical workflow. For instance, we're giving a way for patients to visit clinicians remotely, come into a virtual waiting room to get educated. The physicians see these virtual patients coming in and are mixed in with their in-clinic patients, and they can then take these patients out of the waiting room, have virtual sessions, even bring in a specialist or an interpreter if needed, and then perhaps transition the patients to a nurse or other facilitator that might do some follow-up triage or perhaps schedule another appointment for the patient. So again, what we're attempting to do is not to create new televideo technologies per se, but to create ways in which these technologies can be more effectively utilized in the delivery of these care models for physicians, and primarily for reducing readmissions and improving access to healthcare.